This business about these numbers, very, very difficult. You see, here's the goals. We talked about this already. The goals are to get people into the system for health care. That's the goal. In some cases, like Massachusetts, they get them into the insurance system but may not get them into the health care because of the lack of doctors. But we're going to keep that idea in mind on the back burner for a moment. We're simply going to say the goal is to get everybody insured and, when possible, to give assistance to a business, an individual, or a state. They actually do want to make the thing work, and that's what this math is all about. It's always a question of how do I identify somebody who really needs help versus somebody who only pretends to need help but just wants a freebie. How do I determine whether to truly penalize somebody doing something bad or inappropriate versus somebody who's just meshuggah and messed up? How do I go about that? Well, keep this in mind. This is a study that talks about risk pool and cost analysis, the premium dollars. The theory is the more people I put in the risk pool, the cheaper it could be because I spread my risk. That is true if the things are put up properly. For example, I want you to conceptually think of every form of health care payment in America. How do we pay for health care? We pay for insurance. We pay for it with charity from a hospital and a church. We pay for it from tax-based government programs like Medi-Cal, Medicaid, etc. So think of all those dollars, wherever they come from, and think of them going into a single collective pool for every person in America. Got the picture? We'll call that premium, whether it's actually taxes, gifts, whatever it may be. And all the cost that comes out. Cost could be somebody paying a doctor cash or a hospital taking care of somebody and not getting paid back. It's still a cost to that hospital. So we have all these different kinds of revenues coming in and all these different kinds of costs going out. And we've collected them all in one pool. If you think about it, you could subdivide those pools. You could make the exchange a separate pool. You could make a single payer. A state becomes the single payer. That's the pool. You could have private plans be the pool. You could have social paid programs be the pool. Private insurers, we are pools. That's how we handle it. Whether large, self-funded or pools. All these pools operate with the same basic principle. To get X amount out, I got to put X amount in. I can't put X in and get 2X out. Can't invent something from nothing. So here I have my risk pool. That's a little bit of a dark picture there. That's a shark, if you haven't figured it out. Now, this risk pool concept only works if everybody coming into the pool is operating on some comparable basis. What do I mean? I look at Craig. He is indestructibly young. I think he's probably maybe going on 23. Okay? He's going to come into my pool. Yeah, he's going to come into my pool. And I analyze what's the probability of him needing to take something out of my pool. In other words, get medical care. He's a young indestructible. Very little chance I need that, so I can ask for him for maybe $100 and it'll work. Because I'll get tons of him at $100 and none of them will cost me anything. They're the young invincibles. Now we've got an older person. You're still in good health. I need somebody that's not. And Dennis is my friend. Think about that. Anyway, so I take a look at him and I say, okay, what's the chances that he's going to pay? Well, he's got to pay more. I look around the room and I say, a young lady, what's the chances of her having a baby versus you? Well, I don't have to charge you for having a baby unless something real goes on here. All right? So everybody pays in a proportionate share based upon the risk I'm going to pick up. Got the picture? So I can set up those rules and I can make it such that people who are healthy pay while they're healthy. And so then when they get sick, the money's already inside the thing. Healthy people just pay in advance. Well, that makes great sense. However, what would happen if I didn't do this? If I said I'm going to create a law that mandates you provide coverage, whether it's through an insurance company, a risk pool, an exchange, whatever it may be, and then I'm going to mandate that these assumptions about proportionate pay-in are violated every time. I'm going to mandate you set up the pool, but I'm going to mandate I don't charge anybody any more than $50. Can't work. Can't work. The people who design the exchanges and whatnot, they understand that. At least the intelligent ones do. So the bottom line comes down to this. You take Massachusetts, where they started to violate some of those concepts. And what happened was, of course, as we talked about last time with the April 5th article from the Globe, lots of people were going into the exchange and only buying 3 or 4 months of insurance. They would pay in their $400 for 3 or 4 months because they were sick. And in the meantime, they would get out $10,000 of services. And guess what that would happen in terms of what they were paying into the exchange once they got their $10,000 of services? They'd stop paying. So at some point, somebody else has to make up for that shortfall. In the case of Massachusetts, they were making up for that shortfall by private insurance coming into the system. But they didn't have enough. So they're constantly running shortfalls. After a while, that shortfall, something has to happen. We've got other shortfalls. PPACA clearly says undocumented people, illegal people, whichever phrase you wish to use, do not get the insurance card. How many undocumented people in California get health care? All of them. Because the law says if he shows up in the emergency room, well, the fact that he doesn't have a health insurance card doesn't change the fact he gets health care. So we've still got that stuff coming out of the system, even under the new PPACA. Still got that coming out, and that's got to be accounted for somehow in all we pay. PPACA is going to ban pre-existing conditions. Every kind of pre-existing, private, public, whatever it may be, come 2014, immediate acceptance, no pre-ex. Means testing. We're going to test a bunch of these people, and if Dennis doesn't have enough income, even though he should be contributing a lot more into the pool, he's not going to have to. And in theory, a governmental agency through taxation is going to put that money into the pool. But now you got the realities of $20 billion shortfall, are we going to raise our taxes, and on and on and on. So somehow or another, the state, the people who design our exchanges and work with our carriers are going to have to create rules that keep the field balanced, because if it doesn't, it will inherently go upside down. What happens if it goes upside down? This is on a national level. By the way, these studies right here, this is hard to read. It's called Concepts Outlined in the Study Impact of the PPACA Act on Costs in the Individual and Small Employer Health Insurance Markets. It's by this Jason Grew and Kurt Glessis. What they basically said, by the way, I've simplified their studies. It's quite extensive. But to give you the concept, what they asked was, what would happen if everybody currently without insurance came into the insurance pool and then started getting their health care, if they actually could get it? Well, the bottom line comes down to this. We currently have about 308 million of all the United States people in the pool. Government programs, private programs, whatever it may be. 300. That comes down to about $8,000 of cost per person. Got the picture? Now, the people who are not in this pool are the ones that will become the newly enrolleds as we move forward. And so this study asked the question, if we currently pay out $2.5 trillion, and we currently get in $2.5 trillion, which comes down to about 8,000 a person, what will happen when we add in all these new people? In theory, if the people coming in paid the proportionate share, you'd have no problem. Unfortunately, that isn't how it's going to be working in many cases. So the bottom line is, the average revenue per person across the whole pool will drop. But the costs will increase because many of the people coming in currently don't get health care, currently don't have that covered. Their estimate on this study is that we will rise to 4.5 trillion, or in other words, a 54% increase in the outflow. But we won't be getting a 54% increase in the inflow. Bottom line comes down to, we'll have a cost of about $11,200 per person, nationally speaking. Now, you could take that number and extrapolate it into California if political decisions are made to keep that field on balance. But as long as decisions are made intelligently, the exchange will keep it in balance, and it'll be some other state that'll be shortfalling its revenues. Hopefully. Hopefully not ours. Well, what about that means testing? What about the differing level of aids that come out? The fact that no coverage will be refused. The fact that the employer coverage can be refused. In other words, the individual could refuse his employer coverage and come back over to the exchange. What about the unaffordable coverage issues? All those things have to do with means testing in some way or another. Now, one thing I do want to put a stop to, because it's still out there. Originally in PPACA, there was a part of the act that said if the employer pays $800 for his employee, okay, he's covering $800 and that's what he's spending, the employee could take the $800 voucher and walk it over to the exchange and buy his individual product that way instead of the group product. That was part of the original act, and you can imagine how unbalanced that situation could get. And so fortunately, that was repealed. The free choice provision was repealed in April of this year. So if you have a small employer or a large employer worrying about this voucher thing, they call it the free choice thing, the voucher thing, whatever it may be, it's off the table, doesn't exist. If an employee doesn't take his employer's offered plan and goes to the exchange, he's on his own. The state may help him with premium credits or something like that, but the employer does not transfer any funds. All right? All clear on that? Because that was a problem provision. Now let's go to this. First off, this is going to be real hard for you. We've got to decide, is an employer obligated to either provide coverage or face a penalty? I've repeatedly said to you, generally, it's above 50, where that is true. And I said in my first class, generally means it's not the right answer, but it's a good for a conceptual concept. Because the fact is, 50 doesn't mean what you think it means. A group of 20 could be obligated to provide insurance or face a penalty. A group of 80 might not be obligated to provide insurance and might not face a penalty. All possibilities. So what we have to learn is to go through the tests to determine when are we going to be possibly eligible for a penalty and when not. And the first question comes down, are you a group of more than 50 full-time equivalents? Ban for the moment the concept of full-time employee. That doesn't matter in this case. You can have 20 full-time employees and be a 50 full-time equivalent company and be eligible for penalties. Now, here's what I also want you to understand. Don't get ahead of yourself. Every one of these tests is completely independent of some other concept you're worried about. As I'm going through these numbers, you'll start to ask me questions like, well, what if they don't actually cover 20? It doesn't matter. It doesn't matter whether they're covered, uncovered. It doesn't matter whether they're paid for or not paid for. It doesn't matter whether they live in South Dakota or Texas. The analysis is a pure mathematical analysis, and it arrives at only one answer at a time. The first question is your group more than 50 full-time equivalents? That is only two answers possible. Yes or no. No, right. If it's no, no other mathematical calculations are needed in the system. You're off the hook. If it's yes, it means you may be eligible for a penalty if you don't supply health care. Now, note what I said. Did I say you would have a penalty? No. It may be eligible. Because then the next test we're going to do is, well, what makes you eligible or not eligible? And then if you do have to pay a penalty, which penalties and how often and when and all sorts of things. So we're going to take one step at a time. I over-inundate because if you start to get ahead of yourself, you'll get very confused. Okay, so let's take out our little booklet, the one that's real small, that says tables and formulas. What I'm going to do each occasion is this. I'm going to show you the chart and I'm going to explain it. Then we're going to bring up the blank you see on your piece of paper, and we're going to fill in the numbers so you can actually walk it through. And sometimes we'll have 2 or 3 examples of that, okay? So first, let's explain it. Number one, full-time. This is not on your big piece of paper. This is only on your slide. Full-time is defined as 30 hours a week. 30 hours a week. It does not matter what your employer defines as full-time. It does not matter when he offers benefits. It does not matter anything. This is a pure mathematical calculation. If a person works 30 hours a week, under this law, he is full-time. That's all it means, nothing more or nothing less. Got it? Okay, so how many hours does a full-time person work? 30. 30, there we go, we got that. All right. So an employer who says, I have only 10 employees, and he's thinking, you mean 40. He may not have 10. He may have 50 if he has 30 hours. Starting in 2014, if you have 50 full-time equivalents or more, you may be eligible for a penalty if you don't supply health care. Next stop, okay? How large and how do we calculate? We're going to talk about full-time equivalents. Okay, let's go to this. I put this one up here so it's a little bit bigger. Full-time employees who work less than 120 days in a year are considered seasonal. It doesn't matter what your employer calls them. If I have a guy working 30 hours a week and he works 120 days during the year, 3 months in February, I'm sorry, 1 month in February, 1 month in June, 1 month in November and December. He's got himself 120. He is full-time. If he works less than 120 days, he works 119 days. He accomplishes that by working every third day. But he's working at the rate of 30 hours per week, at the rate of, he's seasonal. Got it? Now, by definition then, what is part-time? If you've got a guy who worked 119 days at 30-hour rate, he is what by this definition? If you got the guy that works 121 days, but only at the rate of 20 hours a week, what is he? Part-time. Part-time. If you got a guy who works 30 hours a week and works more than 120 days, what is he? Full-time. Full-time. Those are your only three classifications. That's it. Got it? Full, part-time, seasonal. See what they're getting at? They're trying to make sure that certain industries, such as construction, where a guy only works 4 months in a row, is treated during that 4-month period like a full-time employee. Got it? Whereas a guy who works in that same 4 months but doesn't meet the 30-hour minimum, what is he? Part-time. Okay? All right? Now we're going to do something with those numbers. First off, we're going to ask ourselves, how many full-time employees are there? What's a full-time employee? 30 hours a week, more than how many days a year? There you go. And we're going to call that, in this example, I have a company, right up the top says 40 full-time and 20 part-time. How many seasonals do I have in this count? None. None. By definition, I'm leaving the seasonals out, all right? 40 employees. Now, what's the total number of hours worked by a part-timer in a month? We're going to just pretend that there's 4 even weeks in a month, okay, to make the math simple. So, if I work 10 hours each week as a part-timer, how many hours did I work in that month? 40. 40. Next element, in calculating your B, how many part-timers, how many physical bodies did you have? 20 in that particular example. So we multiply B times C, we come up with what answer? 800. You got it, Keith? So my total number of hours per part-timer is 40. My total number of bodies is 20. I now have 800 part-time hours. Got it? I now divide that by 120. Anybody figure out where they got 120 at?
The days for seasonal.
For seasonal versus non-seasonal. I divide by 120, and in this example I come up with 6.66, or in other words, I round up to 7. I then take that number 7, add it to my real number of full-time employees, and for the purpose of group measurement, this group is a 47 full-time equivalent group. Does the mandate to supply coverage apply to them? No. No, it does not. Now let's do another one. This time, I have 20 full-time people. This looks like a restaurant. Somebody asked about restaurants. I have 20 full-time people and 40 part-time people. Each one of my part-time people works 24 hours a week. Clearly part-time. Okay? How many go into the first column, A? 20. And total hours worked by a part-timer in a month. If I do 24 hours a day, 24 hours a week, 96 for the month. How many people are used in that count up here? 40. Multiply 40 times 96. I'll give you the answer so you have to get out your calculators. And the answer is 3,840 hours worked part-time. You got the picture? Okay, this is just another example. Now, what do I divide by?
120.
And I end up with a number of 32. What is the size of this group under a PPACA? 52. 52. This group is eligible for penalty. That's what I meant when I said PPACA doesn't mean 50 the way we think of it. A 20-life group could end up eligible for either requiring to give a benefit or paying a tax. By the way, as you know that analysis right now, can you say categorically that this group will be penalized or required to give health insurance? No. No. What are they eligible for? Penalties. Eligible to either be required or give penalties. Because we have to go to the next step to find out if it actually happens. The next step is this. Certain employees are going to behave in certain ways. Now, we've started using the term generically large. We've said large employers are eligible for the tax or the fine or the providing health care. But we now understand large by PPACA simply requires any group with 51 full-time equivalents or more, as analyzed by the math we just did. That may not sound like large to you, but that's what PPACA declares it to be, okay? So, if I've got a company with 51 full-time equivalents or more, even though it's only a 20 full-time, 24 part-time, once I have that, a couple of things have to be decided. Which job categories of full-time, part-time, temporary, seasonal, which count towards the penalties and the requirement to offer coverage? That's not the same question as the first one we had. You're now going into a new world again. You see, PPACA says once you are determined to be 51 full-time equivalents or more, you then have to ask yourself, do your full-time employees get coverage or are you subject to a penalty? The answer would be yes. What if you're part-time people? Are you subject to a penalty or providing them health insurance? The answer is no. The part-time end up to define the size of your group. They do not end up to define who you have to cover. That sounds contradictory, but that's the way the law is written. Okay? So you use the part-timers to determine your count. By the way, did you use the seasonals to determine your count? No. Seasonals didn't give your count, but seasonals have a requirement that they get coverage or you pay a penalty. Yes, afraid so. Afraid so. So, you've been declared a 51 up group. You now do not give any coverage to your part-timers at all, but you cover everybody else in just wonderful fashion. Will there be any penalty? No. Because you didn't have to give the coverage to the part-time people. You only had to count them for the size of your group. Now, see what this says? Yes, you could be subject to penalty on the seasonals, even though seasonals are not counted towards the size of the group. But there's a little catch in here. When is somebody getting a credit? In other words, their behavior. Their behavior will influence the fact whether your group gets the penalty on the requirement or not. You've been declared large. Part-timers don't count now, but what the behavior of your full-time and seasonals, they do count. Let's see what they can do. You see, what we're going to look at is what characterization of the employee creates what kind of penalty. The part-timers never cause a penalty. They cause the count to go up, but not the penalty. And some penalties are per month, which obviously means per month calculation. By the way, I didn't finish this comment. I don't believe this per month thing is practically going to work in any real sense. But I also don't believe that the IRS is going to let businesses who owe money under penalty wait for a full year to pay it. If I'm employed, I might have to file a quarterly statement. I can envision the codes coming out and requiring quarterly analysis on averages or something like that. All I'm giving you is the way it exists today. We don't have the regulatory guidelines out from the IRS who will be responsible for doing these analyses. Okay? Or estimates, whatever it may be. Right. Okay, what do we got? I have 3 possibilities for my employer group. He offers coverage. He offers coverage which is deemed unaffordable, or he offers no coverage. Got the 3 choices? Offering coverage which is unaffordable is a mathematical calculation that we'll figure out in a little bit. Okay? Now, the employee, the guy in the company, he does not have coverage. he doesn't have it at work, and he doesn't go to the exchange. For whatever reason, he just decides he's going to pay the tax penalty. End of discussion. Okay? Maybe he decides that because payroll contribution's too high over here, and yet he doesn't qualify for a penalty over here, so he decides to go uninsured and pay the tax at the end of the year. For whatever reason, if that employee does not get coverage on his own, there is no penalty under any circumstance to the employer. So I have a 52-life full-time equivalent group. Every employee doesn't get coverage, and no employee goes to the exchange, and no employee buys his own. Do I have a penalty? No. My group was eligible for a penalty, but because of the behavior of the employees, I don't have one. Okay? Second category. I have an employee who goes to the exchange. He leaves my plan, or I don't offer one. He goes to the exchange, and he gets coverage, but without premium credits. In other words, he is wealthy enough to afford to buy his own private plan at the back end of the exchange. What happens to me? Am I penalized because of his behavior? The answer is no. Okay? Third category. The employee goes to the exchange, any employee. I have 50 people that go to the exchange. One of them gets a premium credit. I am now, again, eligible for the penalties. The penalty I'm going to be calculated is going to be different, depends upon what circumstances occur. So I get one employee who goes to the exchange, he gets a premium credit or subsidy of some kind. I could be guilty and fined for $2,000 up to $3,000 per employee involved in the count. We'll go through how that's counted, because different employees count different ways. Okay? Likewise here, I offer unaffordable coverage. Then finally here, I offer no coverage whatsoever. Then the penalty will be the $2,000 annual if the same thing occurs every 12 months. Okay? So, I'm eligible for the employee as the size of the group. I'm eligible for the penalty, size of the group. I have employees that go get their own coverage from the exchange but get no subsidy or premium credit. I have no fear. I have all those employees go do it, and one of them gets a credit. I am now eligible for more penalties. And the penalty will be somewhere between $2,000 and $3,000, depending upon the circumstances we're going to look at in a moment. Okay, now, we've articulated a person, a group, employer could be eligible for the penalty. Now the question is, how big a penalty? Because the penalty could end up being 0 or something else, depending upon the circumstances again. So what we're going to do here in this category, we're going to look at, by the way, the penalty size is not that difficult if you think about it a second. First, we're going to do some calculations, and the law is going to say there's thresholds. That is, you have to get your penalties up to a certain level before they count at all. If your penalties are below this certain level, you're off the hook. It's just too small to worry about, apparently, according to the law. Okay? So the penalties are going to be calculated on full-time employees and seasonal. Again, the penalty is not on the part-timer. The part-timer was used in case size. The penalties are used full-time and seasonal. Got it? All right, let's do the calc. Here we go. It's called penalty calculation, large employer not offering coverage. Remember, we had 3 categories: offering coverage, offering unaffordable coverage, not offering. So we're going to take a 51 plus full-time equivalent group, not offering coverage. And we're going to start ourselves. We have an 80-man company. Say, how many people are there? 80. Well, we said that at the top of the title. Got it? We minus out 30 in the mathematics. Anybody want to know why we? Because the law says to. There you go. There you go. It's like one of those deals, they decided you get forgiveness on the first 30 people, I guess, or something like that. So you take off 30 no matter what, and you have a result. The result is 50, of course. All right, got it? Now, you're going to multiply that 50 by $166.67. Can you guess what the 166.67 is? Divided by 12. Remember our column? If you don't offer coverage, your penalty is $2,000 a year. But that's a general statement. It's actually a penalty of $166.67 a month. So your penalty then is 50 times your 166, or in other words, $8,334 penalty for that month. For that month, because your numbers of employees could change. You see, the number, for example, you had one person over here getting the subsidiary. but that person suddenly gets a raise and is no longer available to get the premium credit. Now you've got possibly no penalty. Depends what each of those people are doing. Or you fired him and got yourself a lawsuit instead, yeah. Yeah. Let's just assume, for the sake of argument, that had the same number of people under the same conditions every month, all 12 months, the annual penalty would be $100,008. That would assume absolutely the same behavior. But the penalty is calculated monthly. So you can imagine a large group of 80 without coverage, how that penalty would go up and down each month. Okay? Now, that was why I made the comment about paying the penalty. Will the IRS conclude that you hold the penalties and pay them at the end of the year when you file? Will they want those paid quarterly? Will they want them paid monthly? I don't know. We'll wait for the regs to show us. Okay? But that's how it's calculated. Let's go do another example. Here's our 52-man group. This is our 52 equivalents. And this one is not, this is an example on the board, not on your sheets. This was the company we talked about, that restaurant, remember? And we're going to decide, he is eligible for the penalties. We decided that because of his size. So we're now going to look at the analysis. He is not offering coverage because he's a restaurant. First off, he has 20 full-time people. We already agreed to that. Now, do part-time people count in the analysis? No. Seasonals do. He only has part-times. So in his case, you subtract what? Why? Because the law says you do. That's it. So you've got less than 0. So the monthly penalty comes out to 0, because any number times 0 is 0. So even though this guy was eligible to either require coverage or face a penalty, his actual penalty in that case is 0. So there's no effect to him having the penalty. Okay? Now you understand why I kept forcing you to go back to just eligibility versus payment versus et cetera. Right? That first two examples where you didn't offer coverage. Well, what if you offer coverage, but either the person refuses to take it because he doesn't want to pay his fair share out of payroll, or somebody somewhere decides it's unaffordable to him. That somebody's going to be in that exchange, okay? Two situations. I've got my employees. I either have somebody who chooses not to take, or he chooses not to take because it's unaffordable. All right? And he doesn't get to make that call. Somebody else will. We'll cover that in a moment. Let's see how the penalties then equate. Okay? What we're going to do as an example, we're going to say we have a sample company of 80. We look at that one, and we have our 80 full-time people, each of them working 30 hours a week, more than 120. Got it? We minus out our 30, because that's what we're told to do. We end up with 50. Our third line down, we multiply it by the monthly part of the $2,000 claim. Remember, that was one of the penalties, $2,000 or $3,000, depending on which circumstance, and we're going to walk that through right now. So we have a monthly penalty of $8,334. Multiply that by 12, assuming each month was absolutely identical during the course of the year, and your annual payment comes out again, because we've already done this math, to $100,008. But the column you looked at said unaffordable or not taken could be $2,000 or $3,000 depending upon the circumstances. And here's where we're comparing the two circumstances. The other circumstance that works with the $3,000 is this. The number of full-time employees in A, meaning of the 80, who receive premium credit through the exchange, either because it's unaffordable or because they have a certain income level. So in that example, 20 of these employees apply to the exchange, and they are declared to be either unaffordable or you don't offer it. For example, an 80-man group who doesn't offer coverage at all. Okay? 20 of the people go over, they get premium credits. For those 20 people, the penalty is $3,000 per year. But because it's calculated on a monthly basis, what's a monthly basis of $3,000? $250. So we take the 20 people who got the credits, we multiply it by the $250. Or in other words, it's a $5,000 penalty on this column. He's got an $8,334 on this column, a $5,000 on this column. Okay? Multiply that out at 60. Now what the law says is he's liable for the penalty of whichever is the cheaper. Needless to say, obviously, what would happen if nobody got credit? Remember our chart? Zero. That's what the chart said too. Mathematically, it works out to zero because zero will be on that side and zero is lesser than 100,000. 52-man equivalent group. Remember that little group we had before? It became a 52. In this case, we want to do the math on them. Well, obviously, 20 people were full-time. Minus 0 is 0. You do the math, it comes out to 0. What if one of the people from the restaurant, went to the exchange and got subsidiary? Well, let's say 3 of them did. They got tax credits because, hey, restaurants don't pay all that much. So they picked up their penalties. And, of course, the penalty there would be $750 a month, 3 times $250. Multiply that out by a year. He would owe he's eligible for a penalty of $22.50 or, and which is cheaper? He goes out, no payment. Now we have 52 and seasonal. I've made it easy on you. Full-time seasonal calculates size of group. Full-time part-time calculates penalties and all that sort of stuff. But what happens? I'm sorry, part-times don't count in the penalties. But what happens when your part-times are seasonal, meaning they work 30-hour weeks for less than 120 days during the year? Okay? What happens at that point? Well, let's see. Got 52 people. In this case, we got 20 regular full-time, 20 seasonal. A 52 life equivalency because of the part-timers. We have 40 total because, again, the seasonals are considered full-time. For what reason? Right. The week they worked, the month they worked, they were full-time. Okay? All right? Minus your 30, you end up with 10 in that calculation. Your penalty, $1,667 for each of the months that circumstance arises, such as the 4 months during heavy construction and roof construction, as an example during summer. And you end up with a penalty of $5,001 per year. Now, those seasonal people, the roofers, they have insurance in the exchange, and they have premium credits. But now they're working for your group, but they've kept their plan. That means you're still liable because the government under PPACA says you should be paying for them while they're working for you. But you're not. They may not even want to go on your plan, for all I know. Right. But because they're over here on this side getting a credit, remember our 3 employees? 3 had it before? Well, we've added to 20 seasonal because all of them already had coverage over here in the exchange when they came to work for you. And they're getting premium credits. So now you got 23. You multiply that for that month by 250, you have $5,750, or in other words, a penalty of $17,250. What penalty does the employer pay? $5,001. You got it. He pays the lesser, but the seasonals do count against him. All right? A guy goes over here, and he's going to try to get the premium credit, because remember, your penalties are being kicked off by the premium credit. So now you got to understand what's the math behind whether he can get a credit or not. So he's going to go into that portal, and he's going to be evaluated 4 ways. However they got that personal information. Okay? First off, he's going to be evaluated as to whether he fits into a state or federal program, such as Medi-Cal, Medicaid, Healthy Families, whatever it may be. If he is sorted into that group, it's because he has less than 138% of the federal poverty level. We'll talk about what that is in a moment. So he goes in, they check his income, he's 137% of the poverty level, he is shipped to Medi-Cal, Medicaid, Healthy Families, whatever it may be. At that point, does he get a premium credit? No. That's not considered a premium credit. So those people being shifted into there would not influence whether the employer is going to be eligible for a penalty or not, because no premium credit is given. The whole health care is given. Got it? Second category, he's making more than 138% of the federal poverty level, but less than 400%. We'll look at that again in a moment. He could be eligible for credits. That doesn't mean he gets them. No coverage is eligible, period. He could be eligible if the coverage is offered, but it may not be affordable. Okay? So let me repeat. He's between these two federal poverty levels. No coverage is offered. He will get credits. Penalties will apply to the employer. He's between these federal poverty levels. The employer offers coverage. He still might be eligible for premium credits. We haven't decided yet because it's dependent upon the affordability. So now we go to the third category. Regardless of where he falls at the federal poverty level, some system inside the portal declares that his coverage would be 9.5% or more of his household income. Got it? So the portal discovers his household income is $30,000. The premium inside the portal is $10,000. What percentage would that be? 33%. If it's more than 9.5, it's declared to be unaffordable, and he becomes eligible for credits, and the employer who pushed him over to there, or allowed him to go over there, becomes eligible for penalties. Okay? So when someone says, what is affordability, one of the ways it's measured is 9.5% of household income, if that's what it would cost him to pay for the premium. Now finally, last one. Last one. Regardless of federal poverty level, and regardless of percentage of your household income being contributed to a plan, if an employer offers a plan that is lower than the bronze, that's the 60%. An employer offers a plan lower than the bronze, then the person is eligible for premium credits. So you get two ways to get that. Too much of his household income being applied to his costs, or too little insurance inside the company. Now, what is poverty level? These are the federal levels. Anybody under these numbers is under 400% and therefore would be eligible for a credit. 400%. Alaska and Hawaii have a separate category. This is the rest of the United States, and it's based upon family size. So a single person in Orange County making $43,000 would be under the 400% poverty level, would be eligible for some type of premium credit. That premium credit might only be $1 for all I know. But he'll be eligible for some kind of premium credit if he's below these income levels. And if you look at that closely, you can pretty well guess a lot of employees will be eligible for premium credits if that employer dumps them over into the exchange. Based on family income, the levels will be updated annually. And anything below 138, again, goes automatically into the government programs, Medi-Cal, Medicaid, healthy families. Okay, how are we going to do this? I've said this repeatedly, this business of average covered benefits. How do you calculate what the average person's cost will be? These are actuarial models. Basically, a large company like a Milliman & Robinson who gathers all this data, analyzes and says the average cost for medical care, I didn't say insurance, in Orange County is X number of dollars. Then they do a calculation as to whether that plan design fits 60, 70, 80, 90% of it. And you then code the plans accordingly. Less than 60%, you can be penalized, as we already said. The under 30s is the one exception. Plans with a catastrophic, or in other words, a high deductible type of plan, could be sold, could be given to groups, to people under 30, and it will likely not pass the 60% calculation. Therefore, it's exempted under the law. Okay? Can a 31-year-old get that plan? No. 31-year-old gets that plan, you're guilty of supplying a plan that doesn't meet the act. All right? What about refundable federal tax credits? This is the business of how much credit you're going to get. Remember I said a guy might get $1, might get $20, whatever it might be. Here's how that calculation is going to work. The money is sent directly to the insurance company, not to the person. The state basically comes along and says, you're in the portal, you have the private plan. The private plan costs X amount of money, but you get X amount of credit. So if your premium's $10,000 a month, $10,000 a year, you got a $2,000 credit. You, the person buying the plan through the portal, will pay $8,000 a year. The $2,000 will be paid by the state to the carrier. Okay, got the picture? Obviously, the person's going to have to file a tax return, which is going to negate a number of people going into the exchange, because the credit is based upon a sliding scale. The credits assume the silver level. In other words, they're not going to give you the premium credit if you want to buy the platinum. They're going to do a defined contribution and buy the silver for you. That's what they'll say. So if you are eligible for a credit, if the silver is $10,000, you get a $2,000 credit. It's applied to the silver. That means you pay $8,000. If you go up to the gold, and that's $12,000, we still only pay $2,000 on the credit. The rest comes out of your pocket. You buy up. And we already covered this. Bronze is a 60, silver a 70, gold an 80, and platinum's a 90. Now, let's take a quick look at how we calculate this credit. It's going to be affected by your family size and by your federal poverty level. The cap is set. A maximum will be paid. And PPACA defines how much it's going to be. So, federal poverty level. So first we find out, for sake of argument, we're going to say you have 200%. In other words, your income puts you right here, 200%, your family income, 200% of the federal poverty level. The family size is 4. So you come right across your chart. You've got $27.78. That is the maximum premium you can be charged. Maximum premium you can be charged in that example. The actual cost, hypothetically, in this plan, $5,000 as an example. Okay? What is your credit? The difference. So you will pay $27.78. $22.22 will be shipped to the insurance company in your name. That's how the credit works. Okay? If the plan is $10,000, what do you pay? $27.78. The difference is paid by the state. What are the penalties for non-participation? Self-employed, employed, not employed is not covered. In other words, it doesn't matter whether your employer is paying for it or you're paying for it. Applies whether coverage is offered or not. Okay? Plans that fulfill the law requirement. In other words, somebody wanted to know about waivers. Waivers would include Medicare Part A, Medicaid, Children's Health, CHIP, what we call Healthy Families, TRICARE, TRICARE for Life, Veterans Health Care Plans, Peace Corps plans, any plans established by an Indian tribe, and you thought I was joking about that, didn't you? And plans in the individual market would also satisfy it. We talk about these waivers. These are the waivers that allow you to fill out your tax return that says you've met the need to provide yourself health insurance. This does not mean that the carriers are going to accept these waivers. In the private market, the carrier will still be determining their own rules in terms of waivers. But if you think this through a second, if I got a whole bunch of people moving over here across a whole bunch of companies, and as a carrier I still say it's going to be a 100% coverage at 25 lives or at 55 lives or whatever it may be, I may be literally pushing myself out of my own markets. I may have to adapt what I accept as a percentage. I may have to adapt what I accept as waivers. But that's going to be up to the private market carrier. But I can tell you this. If a carrier doesn't accept, say, for example, individual plans in the exchange, and he says, no, I'm not going to take that. That's not a valid waiver. But another carrier says, I will accept that as valid waiver. Who do you think is going to get more business?
The second one.
Absolutely. And sooner or later, the other carrier will have to change. So, but these are the plans that if you say, am I going to have to pay a penalty or not, any of those will suffice. If you are an individual, you have to have insurance or you pay a tax. We're going to very quickly go through this because this is a sort of a modified tax return. Got it? You're going to look at this when I get to my next slide under the category calculation of individual penalty. But I want to note a few things for those of you who don't know how to do your taxes. You have, generally speaking, total gross income. Generally speaking, no, AGI, adjusted gross income, is a different category. So we're going to keep it simple. If you ask me things like, well, earnings in a foreign country that are exempted for certain kinds of taxable gains, is that included? I'm going to say we're not dealing with that. Okay? Yeah. We're not going to deal with rentals or capital gains versus not, et cetera. We're going to make it real simple for your understandings, okay? You have general normal income. You get to subtract your standard exemptions and your personal exemptions from that amount of money, okay? You may have itemized, for example, but we'll just make it simple. In the year 2015, when it first starts in 2014, your potential tax, your eligible tax, not necessarily the one you're going to pay, but your eligible one will be 1% of your gross income minus your standard and exemptions. In 2015, it goes up to 2%, and after that, 2016, it goes up to 2.5%. Now, if you start to think this thing through again, you will start to say to yourself, wait a minute, so I've earned $70,000, 2014, 1% of that is going to be at the most $700. And you'll start to ask yourself the same question, well, why don't I just pay the tax and forget all about buying the coverage? And again, that's the wrong question. We'll get to that in the last hour. Okay? All I'm doing now is showing you what the penalty will be so that you know what you're facing when somebody tells you what I just said. Why don't I just pay the tax? Why don't I just say the penalty? Because that's not the only thing involved. But let's go through the math first. If you have family members, instead of paying a percentage of your income, you may pay a flat rate. For example, the first year out, your tax on a flat rate for somebody over 18 in your household is $95. That's not a day or a week or a month. That's the whole year. So instead of buying a health insurance policy, you just have to pay $95. That's easy. Those go up. In 2015, it goes up to $325. After 2015, $695, plus it'll be adjusted for inflation for each upcoming year. In next year, I'm sorry, 2014, if you have people under the age of 18, you only pay half the amount. So in other words, $47.50. It escalates up to $162, which of course, if you do your math, is half of that, and it escalates up to half of that in future years. The whole thing is capped on these flat rates at 3 times. Got it? So we're talking about very small amounts of money. Any penalty is capped at the national level of a bronze coverage. What that means is, if you do the percentage of income, and let's say your 1% comes up for whatever reason to $3,000, just hypothetically, that mythical bronze level coverage cost will be inside the tax code, and it will say for your area, your mythical bronze level cost is, say, $8,000. If you owe $10,000, you will then have your reduction to $8,000. You won't pay any more than the cost of the bronze care. Okay? You can see the logic in that. They want you to buy the bronze care instead of paying the penalty. All right. You got the concept? Now we're going to go through the math real quickly. Total income, $60,000. Okay? Standard deductions and exemptions, $93.50. We add those two numbers together. We subtracted them, and we ended up with $50,650. 1% of that means if you don't have health insurance in America, you'll owe $507 on your taxes. Or you calculate the flat rate. 2 family members over 18, in other words, you and your spouse, times $95 in 2014 equals $190. You have 1 kid under 18, newlywed, whatever, and that's $47.50. You add F and H, meaning the flat taxes, and you end up with $237.50. In this case, you pay the greater of the 2 penalties. Remember, our employer paid the lesser, but the individual pays the greater. Grandfathered plans. Remember last time around, we said you're grandfathered if you don't make certain mathematical changes to your benefits. The benefit calculation was based upon the fact that if you make 1 change in excess of something, you lose your grandfather status. You lose your grandfather status if you raise your coinsurance by more than 5%. You lose it if you raise your deductible or your out-of-pocket by more than the cost of medical inflation plus 15. You lose it if you do a copayment, which is more than $5 or more than cost of medical inflation plus 15. My first question when we were doing the prospecting, if somebody says, I know I'm grandfathered, my broker told me, was to ask them, where did they get the Consumer Price Inflation Index for medical inflation? Because if they don't know where they got it, they can't do that calculation, and there's only one place to get it. Now you're going to know it. Department of Labor runs a report, and it's called the All Urban Consumers Index. It analyzes all the cost of things we pay for in the world, and right at the bottom is medical care services. There is a monthly factor put in, which, as you can see in this time frame, this starts back in October, 0.2%, 0.2%, 0.3%, actually went down this one, 0.4%, etc. So if somebody wanted to know the cost of inflation for medical care from October 23rd, 2010 to October 23rd, 2011, they would go back to these charts in March 2010, add up each month as you went along. Okay? And that would be your consumer inflation for medical care. So, now you know where to go get it. We're going to look at your deductible or your out-of-pocket and see whether a change exceeded the $5, the 5%, or the consumer price index for medical care plus 15. We start with where you're currently at. You're currently at $1,000 in an out-of-pocket or deductible. Doesn't matter which one you want to run. Math is the same. Your new deductible or your new out-of-pocket in this example is $1,200. In other words, you raise the deductible $200. What percentage is that? 20. Somebody yelled 20. 20 is correct. 200 is 20% increase. Does that 20% increase exceed medical cost inflation? And the answer is no, actually. Yeah. It turns out that medical cost inflation during that period, which we ran these numbers, was 22.69. With that, I get to add 15% because the rule is CPI plus 15. So I have a total of 37.69, which is lower. Answer, the 20%. Therefore, I'm inside the code. I would not be ungrandfathered in this case because I made a 20% change on the deductible, not a change that exceeded cost inflation plus 15. Now, what I want to do is a copayment. I want to look at a change in a copayment because the rule there is more than $5 or more than cost inflation plus 15. Okay? So, here we go. Keep in mind what we taught you last time. You freeze your date on March of last year, 2010. All your changes are calculated for eternity from March of 2010. If over multiple years you make multiple changes, the comparison is still back to March of 2010. So, in the first year, you've got a $20 copayment. You change that to a $25 copayment. What percentage is that? 25%. What did we just calculate our CPI plus 15 was? 37.69. Answer, you're not ungrandfathered. You're still okay. But now year 2 comes along and you raise it another $5 copay. You haven't violated the $5 copay per year. What you violated, though, is the measurement back to 2010. Because your $25 copayment that you went 20 to 25 last year, you've now gone to 25 to 30. And that's a difference of 10, which is a difference based on the original copay of what percent? 50%. The inflation index has gone higher because you've added another year. You're now adding all the inflation from March 23rd, 2010 all the way to the second year, whatever that may be. And in that hypothetical example, because we don't have 2 years since then yet, we ended up with a 43.87% change allowed. And what did the person actually do? 50%. If he violated that 50% category, if he violated that CPI category plus 15 in any benefit level, RX, co-payments, deductibles, out-of-pocket, internal limits, whatever, he ungrandfathers the plan. And you've got sort of an idea why more and more carriers are ungrandfathering their plans, because it gets easier and easier to become ungrandfathered the more time goes by, because it's not a per year basis, it's from the beginning of the act, March 23rd, 2010.